Hi everyone, my name is Sarah Sargalski and I'm a graduate nursing student at the University of Texas at Arlington. In order to fulfill part of the requirement for Nursing 5309, which is Teaching and Learning Theories and Strategies instructed by Ms. Dolores Aguilar, I will be presenting a video on how imagery is used to increase new graduate nurses' comfort levels when working with pediatric patients. Imagery, according to Billings and Halstead, is a teaching strategy that includes mental picturing, diagramming, or rehearsal before the actual use of information in practice. There's also a recent study I would like to refer to before presenting my topic. This is the Kolk et al. Study, which is cited by a bunch of European names that I can't pronounce. This study examined the effect of imagery in relaxation in children's peri- and postoperative pain relief. The study followed children through the initial intake to the end of their hospitalization. It found that children that were prepared they used an imagery trip CD. These children displayed significantly less distress before and during venipuncture than non-prepared children. For my presentation, I would like to teach new graduate nurses how to use imagery in order to distract the pediatric patient, complete nursing tasks, and ultimately become more comfortable working with pediatric patients. I chose new graduate nurses because they're like sponges. They recently came from an environment focused on learning and may be more willing and able to obtain information more freely than someone that's been out of the learning environment. One of the reasons I selected to teach this topic to new graduates is because I can remember early in my career I was very nervous working with pediatric patients in the emergency room. Now I make it a point to increase the comfort level of anyone I'm orienting while working with the special population. By using imagery, among other strategies with pediatric patients, both the caregiver and the patient will feel more at ease while necessary tasks are being performed. After viewing this video, new grad nurses will be able to develop a better understanding of how to approach and work with pediatric patients. They will also be able to apply their understanding of imagery in order to provide better care to this special population. I will not be coming back after this video, so I hope you all enjoy, and a special thank you to my coworkers for lending their acting abilities. Here's the situation. Cece, a new graduate nurse in the emergency room, needs to take a blood pressure on a pediatric patient. I will be serving as her preceptor and teaching her how to work with pediatric patients. First of all, it is important to provide a safe environment for the patient. You typically want to avoid busy, loud areas. We will put our pediatric patient in this fun, child-friendly room. Parents are also an important part of the pediatric pain management. During interventions, we're going to have the parent actually stay with the patient. When dealing with pediatric patients, it is important to understand which teaching learning strategies work for different age groups. Using imagery typically works best with school-age children. So let's say little Jessie here is 6. Jessie had a really bad experience at her last doctor's visit, so Jessie's very scared. Jessie needs her blood pressure taken. Let's first discuss the wrong way to go about taking Jessie's blood pressure. Hi Jessie, we need to get your blood pressure. I'm going to put this on your arm, and it's going to squeeze your arm, okay? When school-aged children hear the word squeeze, they may think the worst. Now I'm going to show Cece the correct way to take a blood pressure on a pediatric patient. Alright, first I'm going to sit down. It's important to talk eye level with these children. It just creates a more non-threatening environment. It makes me as tall as you, essentially. Hi Jessie, I'm Sarah. I'm going to have to take your blood pressure today, and I'm going to need your arm, and this little device here is just going to give your arm a little hug. Which arm would you like to use? Jessie hears the word hug, she may think of something along the lines of this image, a bit more peaceful than the last one. Now we know how to approach a pediatric patient and perform a non-invasive procedure. Invasive procedures, such as starting IVs, require much more skill, patience, and a heavier use of imagery. So, Jessie, we are going to need to give you some medicine to help you feel better.
Okay.
It's going to go in your arm through a little straw. When we put this straw in your arm, it's going to pinch a little bit.
Okay.
We're going to use imagery here to take Jessie's mind off the upcoming procedure. In imagery, the child is actively involved in visualizing a situation. Jessie, I want you to think about your favorite place in the whole wide world.
The ice cream shop.
That's a good place. All right, so you're at the ice cream shop with your mom. Is it cold or warm?
Cold, and it smells really sweet.
Ooh, I bet it does. What flavor do you think you're gonna get?
Mint chocolate chip.
Yum. Maybe once you're feeling better, Mom can take you to the ice cream shop.
Yes, Mom, let's go.
This is an example of using imagery to decrease the patient's anxiety level prior to the procedure. After the child is relaxed, performing the actual procedure will be much more straightforward. The nurse will be involving the child in the procedure, for example, allowing the child to choose which arm to put the IV in, and going step by step in a language that they can most importantly understand. So Cece, do you have any questions?
No, but I feel like I've developed a better understanding for pediatric patients and won't be as nervous when I work with them. I will also apply imagery when working with the pediatric patients in the future.